Hi, ma'am. How are you? Good morning. Oh, sorry. Good evening.
Good evening.
How are you, ma'am?
Just repeat respiratory system examination. Okay.
Okay, ma'am. Okay, ma'am. Okay.
Ma'am, what?
Other your group mates will come?
Yes, ma'am. Just wait for 5 minutes. They are coming.
Okay. Okay. No problem. No problem.
मासूमा
Mhm.
हाँ
मासूमा
बोलो
मैम क्या कह रही है क्या रिपीट
Respiratory
करें
system. Fatima, I am talking about respiratory system.
फातिमा मैम कह रही है कि ग्रुप बाकी ग्रुप मेट्स लेके आओ. मैंने कहा यस मैम, दे आर कमिंग. 5 minutes, ma'am. Ma'am, today you will ask questions or you will give lecture to us.
तू चुप करके बैठ जा.
Yes, we will discuss about respiratory system.
कौन बोल रही है?
मैं बोल रहा हूँ मौत.
Questions
हमारा-
for Mark.
हाँ तो क्या है कि सवाल करे ना, मजा आता है. मैम, you will ask questions or not?
Yes,
Or you will
yes,
give us
Not.
lecture?
yes,
जा.
sure. Every class you should get marks.
Okay,
Every class
ma'am.
you should get positive
Thank
marks.
you. Thank you, ma'am.
बेटा तू मुझे कहीं मिले सही, तेरे में चंडे मारता हूँ.
यार गलत बात नहीं करनी यार.
माजिद माफ कर दो यार प्लीज, खता हो गई यार.
ठीक है माँ,
आइंदा नहीं होगा यार वादा.
चलो ठीक है.
मेरी जिंदगी गिरवी रख के मुझे माफ कर दो.
कोई चुप कर जा सारे. कर दिया माँ.
How many students present in Bishkek from your group?
Only 4, ma'am.
Ma'am, only 4 students are present today.
Okay, okay.
Yes, ma'am. Ma'am, our group leader lives in mountain area and there are no internet and these kind of things. And Ramsha is suffering from fever, ma'am.
Who is
तुझे
from-
कैसे पता माजिद?
अंदाजा लगा रहा हूँ यार.
हाँ वो बीमार है, उसने मुझे बताया था. बहुत अच्छी information.
Ramsha is suffering from COVID-19.
Which student?
Ramsha Arshad. She is in quarantine, ma'am.
Ramsha. Ramsha, yes?
Yes. Yes, ma'am, Ramsha.
Okay.
Ma'am, how are you?
Very good. Thank you.
Yes, ma'am. MashaAllah.
Hope you are well too.
Yes, ma'am.
Alhamdulillah.
Alhamdulillah. Ma'am, today there is very rainy weather and beautiful weather outside.
Thunderstorm, ma'am. Not beautiful. Thunderstorm. In Pakistan, ma'am, not in Bishkek.
In Pakistan, in Bishkek today is very warm too. Also in Bishkek also.
But, ma'am, today is very cold in Pakistan.
In Pakistan is cold.
Yes, ma'am.
Yes,
It
ma'am.
is. Of course.
Which students in Bishkek? From your
Masuma
group?
Butt. Masuma Butt.
Masuma?
Masuma Bhatt. Ma'am, Masuma Bhatt.
What say your university about offline study in this year,
Ma'am,
in this semester?
Probably in September, ma'am. Most probably.
Mhm. Is third semester medical practice is absent on hospital?
Yes, ma'am, absent. Of course.
Only semesters number 4 and 5.
Yes, ma'am. Of course.
Okay.
Ma'am, can you please pronounce your name?
Aigerim.
What, ma'am?
Aigerim.
Aigerim?
Yes.
And your
yes.
surname?
Ma'am, your surname?
My surname is very difficult. You can remember only my name.
Ma'am, you can tell, no problem.
Her name is Djunushalieva.
What, ma'am?
Djunushalieva.
Djunushalieva.
Yes.
Okay,
yes.
ma'am. Okay, ma'am.
Masuma Bhut is very intelligent, ma'am.
No, ma'am. Alhamdulillah, alhamdulillah. हमारे मेरे एग्जाम आपने करने हैं यार.
हाँ जी, मैं तो वेला हूँ दुनिया पूरी के लिए. कर लेंगे यार, भी आने तो दो. कब है मॉड्यूल, कब है?
15 अप्रैल के बाद है.
रमजान में? रमजान में 2 नंबर ही नहीं करनी भाई.
हाँ तो रमजान में है बिल्कुल.
रमजान में 2 नंबर ही नहीं चलते.
हमारा रोजा रख के मैं तेरी तरफ आया करूँगा या तू मेरी तरफ?
तू मेरी तरफ आया करेगा, इधर एसी चला के बैठा करेंगे बड़े वाला.
और 2 टन वाला एसी नहीं चलाना मात, बहुत ठंड लगती है यार.
यार देख लेंगे वो टाइम के लिए. आज से जिस टाइम पे अगर मेरा अब्बा घर हो फिर मैं तेरी तरफ आ जाऊंगा. कर लेंगे वो, कोई सीन कर लेंगे.
Okay, guys, let's discuss for 30 minutes only. I need around 30 minutes of your time, then you are free. Our introduction to respiratory system. Who will tell about our anatomo-physiological peculiarities of our respiratory tract in pediatrics?
Ma'am, this respiratory system divides into 2 parts, upper and the lower respiratory tract. Ma'am, the upper respiratory tract includes the nasal cavity, pharynx, ostium and other parts of our upper limb. And lower respiratory tract includes the trachea, bronchi, alveolar capillary, bronchial. That's all, ma'am, I know.
I ask about anatomo-physiological peculiarities in pediatric. There are some differences in pediatric by anatomy and physiology than in our adult's body.
Yes, ma'am, there's difference between adult and the children respiratory tract. But we have not learned that yet.
Which differs, you know?
Ma'am, I guess the children affects infection very means they have difficulty in breathing if they are having the chest infection.
Ma'am, the air passageway in children is smaller in diameter as well as smaller in length. Moreover, it is sensitive to pathogens.
Okay, maybe.
Ma'am, actually, you will tell us. We don't know this yet because we haven't learned about it.
The first difference is that mucosa is very rich for vascular tissue, and in babies due to rich vascular tissue of mucosa increase risk for edema, maybe very easy edema after some infectional process. It may be bacterial infection, it may be viral infection. Due to some pathological process, on the babies is increased risk of mucosal edema because our vascular tissue is very has high developed in pediatrics, in pediatric body.
This is the same point which I told ma'am, that the respiratory system of a child is sensitive to pathogens.
Yes, but you don't explain why.
I know what I told.
Okay. Next difference between baby's respiratory tract and adult respiratory tract.
You tell ma'am, we are nothing in front of you
Why?
because you are
get
our
marks.
teacher.
You should get positive marks every class.
Actually, ma'am, we haven't learned about it in the lecture.
Why you don't learn? You should know about it from physiology courses, from anatomy courses. Who is your anatomy and physiology teacher?
Ma'am, actually, we haven't learned about the pediatrics at the physiology and the anatomy. So that's why we are confused.
बेटा अब दे जवाब, अब confused now.
What you prepared? I don't understand.
What, ma'am?
What you prepared? You say?
Ma'am, we haven't prepared of pediatrics and at anatomy and physiology. We haven't learned about pediatrics or about children's. So that's why we are confused.
Previous class I say to prepare respiratory system.
Ma'am, this is our first lecture actually.
Okay, what you prepared for this class? Begin. Give me some information for Mark, please. What you know?
Ma'am, information about यार मर गए कुछ बोलो कोई.
Ma'am, can you please repeat the question?
I ask you, which topic you prepare for this class?
Ma'am, you can ask about the respiratory system of
No,
kids.
Mansuma said that she's confused and prepared another topic.
Okay, ma'am. Let me tell you about the.
And I ask you, which topic you prepared for this class?
Ma'am, I guess major difference between adults and pediatrics is the child is the tongue. The pediatric tongue is larger than the adult in relation to the amount of free space in the oropharynx. The large tongue creates a significant probability for airway occlusion and leaves the little room for airway swelling. Ma'am, breathing rates in resting adults can range from 10 to 15 times per minute. Some adults breathe less and some more, depending on the general health and activity level. And ma'am, children breathing is much quicker because they have little space to exchange the oxygen and carbon dioxide in their lungs. Ma'am, the normal values for blood pressure and pulse rate and respiratory rate change as the newborn infant or child grows and ages. Ma'am, that's little information I'm having. Like ma'am, pediatric airway is smaller in diameter and shorter in length than the adults. The young child's tongue is relatively larger in the oropharynx than the adults. The larynx in infants and young children is located more anteriorly compared with the adults. That's all, ma'am.
Ma'am, can I tell about the diseases of the respiratory system common in children?
Common disease? For example?
Yes. For example, ma'am, influenza, the common cold, asthma.
No. Wait, about them?
Sinusitis.
Ma'am, maybe I was a little bit right. यार बताओ मैम को.
Basically, prepaid pediatrics, it is our introduction to clinical examination. We should know about basics of physical examination in respiratory system. You can tell me about symptoms of respiratory system disorders, main symptoms, which we can meet during respiratory system examination. You can explain me how you will examine the patient with respiratory disorders.
Ma'am, we will use stethoscope first and we will put the stethoscope on his back to examine the lungs if there is any type of mucus in the lungs.
Hamad, physical examination is not beginning from auscultation.
Ma'am, physical examination begins with asking the name.
Yes.
And
You
then
will ask
age.
about name, and you will
Name,
ask about
age, gender, and then
symptoms.
yes, ma'am. First, we will ask about his personal information. Then we will ask about the symptoms that the baby is experiencing from
Tell
his
me about symptoms.
parents.
Which symptoms may be in respiratory system disorders?
Ma'am, it may be cough, a shortness of breath,
Okay.
shortness of breathing, moreover flu, and ma'am, redness is also a symptom. Redness on the skin.
Redness or cyanosis.
Yes,
some
ma'am.
other are palpation, percussion, and accumulation of respiratory sounds, normally first carried out from the back of the chest.
Yes, ma'am. And any of the
after we should
wheezing
begin inspection.
Ma'am,
After we should
the
begin
baby
inspection.
yes, ma'am. Wheezing sound during breathing is also a symptom that a baby must suffer.
During inspection, which things you will check?
Physical inspection, ma'am.
Inspection, yes, physical inspection. When you check baby with respiratory system
we will
disease.
examine his throat.
Ma'am, in a
first
chest
of all.
expansion.
Yes.
Ma'am, place your hands on the patient's hands. Class चल रही है.
You will check how patient is breathing. Is his breathing is symmetrical on both parts of
Ma'am, in pediatrics that I know, they wrap your fingers around the other side of the chest. Bring your thumbs together in the middle line of the baby chest, so that we can examine that the baby is breathing properly or not. And ma'am, place your hands on the patient's chest if he is having the chest expansion.
Ma'am, now can I tell you?
Yes.
Oh.
Ma'am, physical examination classically follows a sequence. Okay, ma'am. Inspection, palpation, feeling with the hands means palpation we can feel with the hands. Percussion and escalation, listening with a stethoscope. Inspection may show important physical signs such as cyanosis, abnormal breathing patterns, finger clubbing, chest wall deformities, superior vena cava syndrome, or Horner syndrome. Palpation may detect, for instance, enlarged lymph nodes, subcutaneous emphysema, or points of tenderness. Percussion may reveal areas of dullness, for example, pleural effusion or hyperresonance. And ejaculation may detect abnormal breath sounds such as wheeze, crackles, or a pleural friction rub signs. Okay, ma'am. That are characteristic of a particular respiratory disease. The clinical history and physical examination provide the essential clues towards the possible underlying respiratory disease. guiding selection of the appropriate diagnostic investigations, laboratory tests, and other respiratory function tests, imaging techniques, or bioscopy procedures, etc. It was the proper physical examination of a patient of a respiratory disorders. Even the doctors can't know this process that I have told.
What?
Ma'am, it is the most experienced kind of physical examination of the.
Yes, yes, yes.
Ma'am, will you please explain us so we can clear the points?
ये बड़ी
कुसुमा बोल
explanation की पड़ी है।
हाँ शुक्र है।
पहले खुद पूछ रही थी मैम, आप सुनेगी ना?
हाँ तो मुझे क्या पता था, जो पढ़ाया अभी नहीं वो सुनेगी।
Hamad Tariq,
Yes, ma'am.
question for Mark. Normal respiratory rate for different ages, for different pediatric ages, and tell me about pathological types of breathing.
Ma'am, have you given me 5+ marks?
I will put 5 for Muhammad Majid and Masuma.
Okay.
Ma'am, the normal respiratory rate of the pediatrics for an infant, like for those who are 1 to 12 months, 0 to 12 months old, their respiratory rate should be 30 to 60 per minute. And for those of 1 to 3 years, their respiratory rate should fall to 24 to 30, 24 to 30 or 40 per minute. And those of above 3 years to 6 years, it would be 22 to 34 per minute, and about 6 to 12 years it would be 18 to 30 per year. And with the time, the age processes, and a boy got older, his respiratory rate falls and come to 16 to 20 per minute.
Okay, and pathological types of breathing. Kussmaul's breathing, Biot's breathing, chain stokes breathing.
Ma'am, in pediatrics?
Yes, they are same as in pediatrics and in therapy.
Like, ma'am, apnea, eupnea, orthopnea, dyspnea, hyperpnea. This you are asking?
No, pathological types of breathing. Biot's breathing, Kussmaul's breathing.
Sorry, ma'am, I haven't learned about it. Never heard about it even. Can you please type? Pathological respiration, CISA respiration. The chest falls on inspiration and rise on expiration. It is usually observed in respiratory failure of third degree. Shyness, strokes, breathing is a cyclical increase in and decrease in the depth of respiration. Biot breathing is totally irregular breathing with no pattern. And Kussmaul, slow, deep breathing, hyperventilation, gasping, and labored respiration. Ketoacidosis, it is also called.
Kussmaul's breathing we can meet on their hyperglycemia complications at ketoacidosis, yes?
Yes, ma'am.
About percussion. Auscultation I will explain next practice class. Hamad 5.
Thank you, ma'am.
And last one is Fatima. Fatima? Fatima is here. Fatima. Fatima is sleeping. About percussion auscultation, I will explain on hospital next practice class clinically how we should do percussion, how we should do auscultation on real patients, okay, on hospital.
Yes, ma'am.
Today's class off. I'm very tired. I'm from 48.
Yes, ma'am. And only there are 2 children, so what can we understand? When all the group will come, we will take lecture then.
Okay. Next
Yes,
practice
ma'am.
class, I will be on hospital and I will show on real patients. All this
Okay,
Okay,
ma'am.
ma'am. This would be a great favor, ma'am.
Now you are free. Class is
Yes,
off.
ma'am.
Thank you,
Bye
ma'am.
bye.
Take care. Take care, ma'am.